Kia ora. He Pakia Tuturu Aho, I tuku ake I America. Ko Tūranga te kainga tuturu in INA. Kua noho toko whānau ki konei mo ngā tau e te kau mā toru. He takuta hapatanga, e mahi ana ki te hoi pera ki konei. Ko Sean Pocock tuko ingoa.
Kia ora, Sean.
Kia ora.
Ngā mihi nui ki ake. Thank you so much for your kōrero. And just to say, we've had a little bit to do with each other around basketball and our sons and the kura. And I'm really proud. I'm really proud of you.
No.
That took me by surprise. Not that I didn't think that you could give a pepeha, or kōrero for that matter, but I really love that. Thank you for having the courage to kōrero like that.
No, thanks for giving me the opportunity.
Yeah.
So
beautiful.
But yeah, I'm American, grew up there, did all my medical training there, and my family and I moved out here after I'd been working. I guess I'd been full practice for 5 years, finished training and been in practice for 5 years, and we wanted a better place for us and our kids, and we were fortunate enough to have the opportunity to come to Gisborne, and we've never left. So it's been great.
Well, I think nā mātai te wai Marie, we're lucky to have you in Gisborne because we are short on doctors here, and we need people like you coming into the community and doing the mahi that you do, so thank you. And also thank you for sharing your time today while we get into the nitty-gritty about women's health. So give us some background around your knowledge of women's health and your experience in women's health.
So, yeah, my pepe I said it was a pregnancy doctor, but really I'm an obstetrician and a gynecologist. So, all those areas of women's health. We do focus a lot of our time on pregnancy care and helping deliver the babies, but also regular gynecology issues as well here in Gisborne.
What does it take for you to be able to work in a position like that and gain trust? What do you think it takes to gain trust within our community here in Gisborne and in your profession?
So it is difficult sometimes. I think whenever somebody new starts up in the job here, you see them struggle to gain that trust, and it takes time, and not just with the people and their families, but also the other healthcare workers and just members of the community in general. However, we are fortunate to be in such a small, tight-knit community that it doesn't take long before people know who you are and what you've done and what you stand for. And then it just flows on. And by now I've been here long enough that most people know somebody I've had contact with professionally, and I think that helps a lot.
So you're a member of the community, you're a trusted face, you're familiar, Dr. Sean in the community, and how did you end up like that?
Well, a lot of it was to do with our children. They were 3 and 5 when we moved here, and those are easy ages because you're involved in so many kids' activities, and you're also involved with a lot of people who are of the, in the community, who are then of the age where they are also. You also see them professionally, so the network just grows and grows really quickly, and almost too much. It can get difficult when you go out in public, and people look different when you see them in public than when they're having their baby, right? So that like, I know you, but I can't, so that could be funny, but yeah, it's just an easy profession, easy place to form those connections, right?
I think what I'm also hearing is you immersed yourself in the community. You became part of the people that you're serving. Is that
Yeah, for sure. And that was super important to us as we came here to be part of that. And we left big cities because, amongst other things, you don't necessarily feel that. And we wanted to be part of the community. And my wife has had several jobs here, but they've all been community facing jobs, and so she makes lots of connections that way. And obviously, having your children grow up here, so it's that's been great. And you hope in that time you do enough that you gain most people's trust, right? So
tell us about the role of the community, the role of hapu mama in taking control of their health.
so obviously there are challenges that everybody faces, and it can be difficult to have that control over your health. And uh, but we're also fortunate in that we have a fairly tight community, and what one person or what one fauna does affects others, and uh, and we encourage, especially our hapu mama, well, their whānau, really, to help support them and make it easier to control the things that they can in their pregnancy, because there are things you can't, and so we want to maximize the control over the things we can.
Nice. So we're in the middle of, is it called a measles outbreak at the moment? Is that what we are in right now?
That is true. Yeah.
Nothing in Tairawhiti as of yet, so I've seen that I can gather. But when we're talking about the control a mama can have over her health, what kind of control can we support or promote in this situation? It's pretty scary that the measles are here in New Zealand.
So, well, this brings us to vaccinations in general, and how vaccinations are really, to say easy. I know that's a bit of a loaded word, but an easy way to do something to protect yourself when you're pregnant and to protect your baby. Um, However, and we can talk more about that, but measles isn't necessarily the best example of this because we don't give measles vaccines when somebody's pregnant. We think that most types of vaccines are very safe, but measles we're not so sure about. So we don't normally recommend um, that people get that vaccine when they're pregnant. However, as soon as they've had the baby, we would recommend that they do, to protect themselves and their whānau and the community, and not to wait obviously till they get pregnant again or in the same situation, I guess. And then and for people who haven't been vaccinated, now is who are not pregnant, now is the time to do it. So you have that immunity to protect, you, like I say, yourself and your whānau, but also those members of the community who either can't be vaccinated or haven't been vaccinated, because that's where outbreaks happen, is when it starts, the infection starts finding those people. There are several vaccines that we recommend in pregnancy, and one of them is the tetanus, diphtheria, and pertussis, which most people have had, but we recommend you get the booster, get boosted, I mean, every pregnancy, because if you time it right in the pregnancy, it means that you can protect the baby after it's born in those first few months when it's developing its immune system. And likewise, everybody in the fauna needs to be protected. It needs to be vaccinated as well if they want to give that wraparound protection. So, so the babies are protected until, like I said, they can develop their own immunity. some vaccines in pregnancy we recommend to protect the baby, some we recommend to protect the mother, because mothers can get really sick in pregnancy, and pregnant women on average will have worse infections with those than those who are not pregnant. So, and vaccines are, like I was saying a few minutes ago, are an easy way to protect against that, and a safe way to protect against that. So,
Can you share with us some experiences around of what you've seen around mothers who vaccinate and get immunized, and their babies who are immunized as well? And what are some success stories that you've had in being able to support whānau into that kind of health?
well, fortunately, I've only ever seen positive results. I've never seen, I mean, obviously you don't know for sure what would have happened if they hadn't gotten vaccinated, but I haven't ever seen anybody in my career who has been seriously adversely affected by a vaccine. And that goes along with all the information that, the scientific community tells us, is that these vaccines are safe in pregnancy. But I have seen, especially when I used to work in bigger hospitals in the States, I have seen women get very sick with infections like the flu that they didn't need to get so sick from. Obviously, no vaccine's 100%, and the flu vaccine is a good example that it doesn't always work. But when it does, it's which is very, very crucial. And again, it's one of those vaccines with, if the people who come in contact with somebody who's vulnerable, like a pregnant woman, have that protection, it reduces the chance that person will ever even get exposed to that infection.
What does it look like to apply something that directly results in more trusted health workers?
Well, I like to think it's the time you spend together, and that can be something that is difficult with that in the healthcare system at the moment. That is under a lot of strain for various reasons, and it's harder to get to see your GP than it used to be, and when you come to the hospital, sometimes you have to wait longer, and sometimes appointments or even surgeries get canceled, and it's frustrating for the members of the community. But all we can do in those situations, try to do our best to make sure that every time we do have contact with somebody, is that they know we've done the best for them that we could. And I believe that if you keep doing that, in the end, most people will see that, and will have a higher level of trust in us individually, but also the system that we work in. So
there's a saying in Māori, he kanohi kitea, someone who's always seen. So I like that kōrero. We talked a little bit off camera before we started recording about the population health. That's an interest of yours. You'd like to learn more in that space because you think it gives the people power?
Exactly. I mean, if you want to boost the well-being of individuals, it's reciprocal, but you want to boost the community so they have the opportunity to thrive, right? And that obviously can be done in lots of different ways, but in healthcare, coming back to vaccinations, that is a very I'm going to say easy again, a way of making a difference, and getting it positively affecting a lot of people, both the ones you vaccinate and the ones that they come in contact with. But even with individuals, you feel like if you give everybody the best start on life that they can get, that obviously they will be better off, but the whole community will be. And so that's one of the reasons that taking care of people when they're pregnant and during the delivery of their children is extra rewarding because you know it can give them that boost on life.
In your mahi, if you're being visited by hapu mama, what kind of support do they have, or what do you think support looks like in those situations? Because you don't always see mama straight away.
No, no. Ideally, Papa Mama will be taken care of by their midwife in the community in Gisborne, and they never need to have contact with the doctor. If they have to have contact with the doctor, it's because something is making their pregnancy higher risk, either for them or for their baby. And so we always encourage everybody to see midwives early and as often as is recommended, get all the tests done that they need to get done, and take the advice of those midwives they're giving them, and hopefully that will be enough for a happy, healthy pregnancy, and they won't ever have to come see a doctor. If they do have to come see a doctor, then we really like it when whānau comes too. Because often there are issues that need to be addressed as a whānau, not just as an individual. Also, I think it's hard when you're nervous and you're worried about your pregnancy, how your pregnancy is going, worried about your baby, to come and talk to a doctor, and you don't always. It can be difficult to remember exactly what was discussed and what that advice was, and so if you're there with your whānau, if you're there with your midwife, then there will be that collective ability to just kind of talk it all through again, and then if there's any questions, you can ask your midwife. We can get back in touch with us, or come back and see us, or whatever is the most appropriate way of handling that situation. But the supports is crucial. It's hard to go see, especially for that first visit, to go see a doctor by yourself when you're pregnant and have to deal with that all by yourself. Yeah.
What does the support system look like, or what do the supports look like? Are you visited much by hapu mama and their support systems, or not?
Usually we are. Usually I think it's pretty good. Hapu mama usually come with their partner or their mother, or their auntie, or their sister, or somebody usually comes with it. I think people recognize it's important to have somebody there, those extra ears, the extra voice to advocate for you or to explain the situation. So fortunately, mostly that does happen, but yeah, we'd like it to be always.
And I want to come back to your mahi, your day to day, or week to week, and our health professionals also need tautoko, need support. What kind of support what kind of systems can be put in place that would help grow that support for you, and that would also reflect support in the community from you guys outside of a clinical base? What would that look like?
So first of all, I have to say again, this is a great place to work, and being in my place, I mean Tātau in general, and there is some of that support just comes naturally for the kind of community it is. But if we have the resources we need to feel like we are doing a good job, that goes a long way to making us. I was going to give us that support, but even more than that, just to fill in like you're doing what you're supposed to be doing, right? So, and those resources can come in different ways, but it's often human resources. If we have all the people working at the hospital doing the jobs that need to be done, then you can focus on your job and do that the best you can do, rather than worrying about all these other aspects of what needs to happen for healthcare. Uh, that isn't necessarily what you're trained to do. So uh, that is what we keep advocating for is more support in all across all professions who work in healthcare and in Tātau.
So it's up to all of us. It's up to, you're talking about you're not trained to do it, but there's a type of, I guess it is community, when you need to come together to make something work.
Right.
Yeah.
Right. Well, no, definitely for sure, and even more so, I think if the community can do things to uplift themselves, to keep themselves as healthy as possible, and to keep their whānau health and their neighbors and everything, that has a massive effect on the work we do at the hospital. It's always sad when you are having to help people with issues that didn't need to happen, and for many reasons, and this kind of goes back to what we were talking about before, is that the more that people control what they can in their lives, and I know that's easier said than done, but the more that people can have that control, um, the more that we don't see the negative roll-on effects from that. And so it's always really heartening to see things like the Tūranga challenge and activities like that so many people participate in, and you just like to see things like that and more if we can. um, the community helping each other.
Can you share with us something that you've come across why people wouldn't want to immunize?
So it's a complicated question, and this has been studied worldwide trying to find the answer to this, because from a healthcare provider's point of view, vaccinations just make so much sense. Uh, but one thing that we realize is that most people who don't get vaccinated don't do it because they don't want to. It's because it was too difficult for them to do so. And it's important that we just maximize the access that people have to vaccines and make it easy for them to get them. And it's important to know that in Gisborne you can go to your GP and get vaccinated, and that uh, is the classic way to do it. But there's also the vaccination center, Ko-Fi House on Palmerston Road, where you can just walk in and get your vaccinations. And this is anybody, adults or children or anything, and that is, and people knowing that they can do that, I think is sometimes an obstacle for some people. For others, it's just not understanding, or understanding, but thinking that it's okay to wait and they'll get around to it someday. And sometimes that's true, but sometimes it's not. And if we all had the idea that, hey, this is very important, and went out and did it right away, we could reduce the amount of infections going around the community. And part of it is also just the information that's out there. I mean, I can sit here and tell you that in my experience, I haven't seen problems with vaccines in pregnancy. All the evidence I've seen says that they are safe, and I believe that. But there's other people who believe the opposite, and I know how that can be difficult if you're a member of the community and you're not sure who to trust. But I would encourage everybody to talk to, if they're pregnant, talk to the midwives about it, talk to their GPs about it, talk to us about it when you see it, and we can give you the information as well as we understand it. And to be honest, it's also hard with COVID not that long ago, and that was hard for all of us, and for some of us really hard, and some members of the community was really difficult, and you can see why that would maybe shake shake people's trust in the healthcare system. And we just got to rebuild that trust and just do it with connections and try to get something as important as vaccinations back on the positive side of people's mind, because it is important.